Hi everyone, welcome back for session 7. We're going to be talking about sleep management. Please don't forget to press like and subscribe. Thank you. Welcome back everybody. This is session 7, focusing on sleep management. Now there's no doubt that lack of sleep impacts everyone adversely. People who have chronic pain, however, are affected differently by lack of sleep or excessive sleep. In order for the body to replenish itself, in order to be re-energized, revitalized, adequate sleep is essential and fundamental. Lack of sleep leads to increased pain, and the intensification of pain is a vicious cycle, which we've talked about before, which leads to more stress, more helplessness, more anxiety, more depression. Again, so excessive sleep can also lead to inactivity and the inability to move forward with whatever given tasks are on that day. Because the more you sleep, sometimes the less active you are, the more tired you are, the more fatigued you are. So in order to find the balance of less sleep, too much sleep, excessive sleep, enough sleep, adequate sleep, I would say about, at least a given 7 hours, 8 hours a night for an adult, depending on the person. Some people need a little bit more. However, less than 5 hours of sleep can become extremely problematic throughout the day. Especially people who have chronic pain are also taking various different kinds of medications as well. And these medications work more effectively when the person's body has been recharged overnight, so to speak. So lack of sleep or excessive sleep, we talked about how it exacerbates pain. Now, if you're not sleeping, your body's not resting, your body, it's almost like your car is running out of gas, right? So when you wake up, you're not energized. Therefore, you can't engage in regular activity and exercise that is essential for coping with your pain. Now, if you are sleeping more and you're sleeping excessively, your body becomes more tired and therefore you become more lethargic and more in pain. So your pain is intensified. So either or, your pain becomes intensified. Finding that balance is key. Now, people who have chronic pain, most of them are taking prescribed medications for managing their pain. Now, some of these medications already contain sleep aids. The medications are used for sleep in conjunction for pain. Now, if there are any additional medications that are to be taken for sleep, consulting with your physician is extremely important in order to avoid any contraindications that the medications could pose when taken together. Now, generally speaking, this whole idea of being able to shut off your mind when you go to sleep, I find that women have a more difficult time of deprogramming at nighttime, I like to call it, in order to sleep. Now, men have a greater likelihood of being able to put their head on the pillow and falling asleep, whereas women tend to take longer where they're thinking about various different things that inhibits their ability to sleep. Throughout the day, you're busy, you're not thinking about all the things that you're worried about generally, but at night, when everything is settled down and it's quiet and you're lying still and there isn't much to think about except the things that are troubling you or that are concerning. So what I suggest, or technique to a lot of my patients, is that take 15 minutes before you go to sleep. 15 minutes and write down all your anxieties, your concerns, your worries, as well as any tasks that you need to accomplish the next day. Not necessarily for the whole week, but I would just say focusing on the next day. Take that 15 minutes, look at your list, and spend that time worrying about what it is. So basically you're putting aside 15 minutes of worrying time or thinking about things that you need to do. Once you've spent that 15 minutes, and when I say 15 minutes, restrict it to 15 minutes, actually time it if you have to. Put away your list, lie back down, and try to sleep. Or keyword here is try, of course. So shutting off our minds, which we'll be talking about with respect to mindfulness in future sessions, will also be helpful. But to be able to, even if you start to have those thoughts again, when you're thinking about things that are worrying, again, bring yourself back to listening to your breath, listening to your heartbeat while you're trying to sleep so that you are disengaging from your active mind or your mind that is focused on your worries and your concerns. So sleep medications obviously can be very helpful. Again, consult with your doctor in conjunction with what you're currently taking. Additionally, sleep meditation techniques. We'll be talking about meditation specifically later on, which also encompasses mindfulness meditation. But I find that YouTube, where basically you can find absolutely everything, has a lot of different sleep meditation technique videos that can be really helpful depending on each person. So you need to choose one that is more appropriate or fits you better. Don't expect to, put on the video in the first night within 15 minutes and fall asleep. If you do, that's fantastic. However, this is something that takes practice and takes time. The greater likelihood of being able to use the meditation techniques effectively is really contingent upon your ability to focus on that task at hand, meaning that you're able to stop thinking about all the things you're worried about, all the things you're frustrated about, all your anger, frustration. So essentially what I'm suggesting is putting all the emotions to the side and just focusing on an instrumental task of going to sleep. So if you check out the videos, I don't have a specific mind in mind. Like I said before, it depends on the person. Some of them are not helpful, some of them are, some of them take time. There are ones that are very short and ones that are longer. So depending on what you feel most comfortable with. Again, like anything else, it takes practice. So you need to actually commit yourself to the idea of maybe every night, 5 minutes, 10 minutes, and see what happens. Over time, it'll start to work for you, hopefully. Again, depending on how much you're able to engage within the moment, as opposed to what's going on up here in your mind. So clear out the noise in order to be able to focus on sleep. The most important, I think, fundamentally, that really is an impediment with respect to sleep management is your phone. Your phone, your iPad, any kind of electronic device. Now, I know that especially with what's going on now with, COVID, people are even more on their phones than ever before. So this is absolutely the greatest detriment to sleep, because what I find is, of course, people are sitting there in their beds or they're lying down and they're scrolling through social media, whether it's Facebook, Instagram, whatever it may be. That's an impediment regarding sleep. Additionally, people who have chronic health issues, tend to use that time at night to go on Google, or rather Dr. Google, and type in various different ailments or conditions, perceived or otherwise, in order to symptom check or check for diseases. All these things they create more anxiety, they increase your stress level, which is cortisol, and it impedes upon your ability to sleep. And you're sitting there with your phone, and it's very addictive. It's an addiction just like any other addiction, and you can't stop. You find yourself, you spent now 45 minutes on your phone doing absolutely nothing that's productive, and you are unable to sleep. So the more you look at your phone, the greater the likelihood is that your sleep will be affected adversely. So now your cortisol level, which was the stress hormone, when you're looking at your phone, it's up here because you're focusing, depending on what you're reading, but generally speaking, it's not going to be able to, you're not going to be able to detach yourself from whatever you're doing in that moment. If it's very stressful, obviously your cortisol levels will be up here. And what we need for sleep time is melatonin. So melatonin, which is what your body naturally contains, right? We want to intensify that. So if your stress level is here, your melatonin level is here, you're not going to be going to sleep. So put away the phone, practice putting away phone, or just like writing a list for problems and tasks. Maybe give yourself 10 minutes if you absolutely can. Spend 10 minutes on that phone, and then once that 10 minutes is up, put the phone away. So additionally, I have to say that melatonin, which I was talking about, melatonin tablets, sublingual tablets under the tongue, pills, gummies, what have you, can also be helpful to increase the level of melatonin you currently naturally possess. Now, again, disclaimer, ladies and gentlemen, disclaimer, please check with your physician before you take melatonin, especially people who are already taking other medications, okay? So I am obviously not, saying that it's bad for you. What I'm saying is that you need to check with your doctor. It's a natural supplement that increases your melatonin level in your body. However, again, since we are not sure of the contraindications with other medications, it's important to verify that information before you take any kind of additional sleep aid, whatever that may be, whatever natural product it may be as well. So alcohol. Now, alcohol with respect to a healthy person who does not have any pre-existing conditions can aid with respect to sleep. Now, the caveat here lies in the fact that you can fall asleep faster when you drink alcohol. However, alcohol actually impedes upon the quality of sleep, which is REM sleep, rapid eye movement. So in the grand scheme of things, alcohol is not beneficial to sleep. Now, people who are experiencing chronic pain and are taking medications probably are not supposed to be drinking alcohol on a regular basis anyway. So that might actually pose to be a greater detriment. Again, check with your physician. However, generally speaking, alcohol adversely significantly affects your REM sleep. And once your REM sleep is affected adversely, your quality of sleep is going to be lower. So being cognizant of that is also important. Now, generally speaking, obviously, when you want to sleep, the lights should be dim or should be off, especially if you are actually ready to go to sleep. So if you want to go to sleep at midnight, don't go to bed at midnight. Go to bed at 11:30 because you need that kind of downtime to get ready to sleep. So whether you are getting ready, whether you're writing your list, whether you're reading something, you need that kind of 30-minute grace period in order to do that. Drinking warm fluids. Warm fluids, what I mean is being cognizant of the amount of caffeine that you consume. Obviously, no wonder caffeine can make it more difficult to fall asleep. If you are a coffee drinker, like I am, I would limit to possibly 2 coffees a day, one in the morning, one in the afternoon. No caffeine after 4 p.m. Now, this is my personal opinion. However, you have to ascertain what is best appropriate for you. However, after 4 p.m., again, we're trying to increase our levels of melatonin, not cortisol. So caffeine works hand in hand with cortisol to get you up here, but you want to be here, not here. So being cognizant of the amount of caffeine that you consume on a regular basis could also be helpful with respect to sleep. Herbal teas, milk. Milk, again, I would say not with cocoa. Cocoa does contain caffeine and could also, make you more hyper, again, depending on how much you consume. This really is a trial and error depending on what you're used to and what works for you. There are people who drink copious amounts of coffee and are unaffected. So again, it depends on how you feel. It depends on the kind of pain that you had. Maybe you had a really bad day. Maybe you had a lot of pain. Depending what it is, all these things are factors that work together. Exercise, again, as I said, I'm an absolute huge proponent of exercise. Exercise gives you energy for when you need it and basically tapers everything off and calms everything down, shuts everything down for when you want to be shut off. So exercise is necessary in order to make you tired for later on in the day. If you're not just lying around the house all day long not doing anything, it's not surprising you can't fall asleep. So exercise is, I think, best in the morning. That's when your energy level should normally be the best. Again, depending on some people may not be. I'm generalizing, but you need to specify in accordance with what you're feeling like on that day. Now, exercise before bed is a two-way kind of contradictory situation where before sleep, it can make you tired and therefore able to sleep. However, it can also make your cortisol levels go higher and therefore you might find yourself unable to sleep. So the only way to figure that out is to try. So, try and see before bed, not right before bed, maybe a couple of hours before bed. Does it work for you or not? Again, notwithstanding the differences between people, I think that morning exercise would be best. Now, taking a warm bath, relaxing, meditation, like I said, all those things can be possibly helpful. Again, remember that people who are taking sleep medications already, might have an easier time than people who may not be. Again, check with your doctor if you add anything else to that cocktail. Another one that's pretty important, I think, is the concept of naps. Now, avoiding naps. I think that if you're finding yourself napping throughout the day, you will absolutely have a harder time falling asleep at night. Now, having said that, I'm sure people will argue with me and suggest that power naps, 20 minutes a day are effective. Maybe. I don't nap. I'm not someone that is a proponent of taking naps. However, I mean, if you're sitting around the house, you've exercised, you haven't gone to work, you haven't really been active, I don't really see the reason for a nap. However, if you were sleep deprived from the night before, you might need a nap. If you absolutely have to nap, like it's a have to, limit that to 20 minutes power nap. Toddlers and infants nap. Adults don't need to nap. Again, in my opinion. So if you have to, limit the nap to 20 minutes max. Because if you sleep more than 20 minutes throughout the day, you actually increase your likelihood of becoming more fatigued and more lethargic. So you want to be active throughout the day and kind of relax and slow down as the evening approaches. So remember, the napping needs to really be, as a last resort. If you're tired, but you're kind of okay, I would say go with that. You will have a likelihood of sleeping at night better if you avoid that nap. Going to bed every day and waking up at the same time is also very, very important and can be really helpful because you're establishing a routine and your body, like everything else, gravitates towards that and you become used to that, right? So there are many people who on the weekends try to kind of make up for the sleep deprivation that they experience throughout the week. In actuality, in the long term, that works against you because what happens is if you're sleeping in on the weekend, Saturday morning, Sunday morning, Monday morning, you're gonna have a really difficult time because you've been used to sleeping in. Those 2 days really affect you. So if you can, of course, there are gonna be days where, you're gonna sleep in. That's fine. I'm just saying on a regular basis, if you can wake up and go to bed at the same time, you'll find that, again, that's also something else that will help you fall asleep and stay asleep throughout the night. Meditation, again, which I said we'll talk about, but if you're already into it and you want to do it, it can be super helpful. Again, you have to really be committed and you have to give it a chance. Not for everyone, depending on, how you feel, whether it works for you or not. Again, it's something definitely try. Now, also reading. I think instead of the tablet, instead of the phone, instead of the TV, actually reading can help tire you out. Again, I'm talking about an actual book with pages that you flip. So I'm being facetious because I find that people don't read. People are constantly scrolling through the phones and reading whatever it is on the phone. Pick up a book, an actual physical book, read the book. Now, obviously, if it's something really exciting, it's going to keep you up. So something that's relatively not as interesting, read a book and you start to doze off and you fall asleep. So that's much better than sitting with the TV on and waiting to fall asleep. Lastly, something that I think should really be thought about with more attention and more detail is that when you have chronic pain, you're thinking about it every single day. I don't think there's a day that goes by that you don't think about your pain. So you're already stressed about that on a regular basis. Now, depending on who you live with, who your significant other is, or, just whatever environment that you're in, any discussions that you may be having prior to going to bed should probably be limited to things that are not stressful. So if you can avoid, again, I use the word if because it may not always be possible. We don't live in an idealistic world, but realistically speaking, if you can try to limit any kind of serious discussions or any argument, anything that's stressful, to not be discussed right before bed would be extremely helpful because you're supposed to shut off your mind in order to sleep, not to become more heightened. So I hope that this was helpful. Please don't forget to press like and subscribe. See you next week.